Maine public, we are less than a minute away, or about a minute away. Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention, and I'm delighted to be joined this afternoon by Commissioner Jean Lambrou from Maine's Department of Health and Human Services. Commissioner Lambrou and I are here with you today to talk with you about everything that's going on with respect to COVID-19 for the entire state of Maine for today, Tuesday, March 30th, 2021. And I begin today's update on a sad and somber note. The Maine CDC has received reports of 2 additional individuals who have died with COVID-19. One was a resident of Penobscot County, the other a resident of Oxford County. Both were in their 80s. One was a man and one was a woman. Their deaths mark the 737th and 738th deaths associated with COVID-19 since the beginning of the pandemic. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of both of these individuals. Right now across the state, there are a total of 50,253 cases of COVID-19, an increase of 223 cases since yesterday. Of those, 38,594 are confirmed cases, and 11,659 are probable cases. Cumulatively, 1,666 people have been hospitalized since the beginning of the pandemic. And right now in Maine, 78 people are in the hospital. 24 of them are in the intensive care unit, and 7 of them are on a ventilator. Among all of our cases to date, 4,401 have been among healthcare workers. Turning now to where we are with respect to testing. Our 7-day PCR positivity rate now stands at 2.1%, and our testing volume stands at 613 PCR tests that are being conducted for every 100,000 people in Maine. Antigen testing stands similar, where our positivity rate is now at 4.96%, with a testing volume of about 195 antigen tests that are being conducted for every 100,000 people in Maine right now. Next, on to vaccines and vaccinations. Overall, there have been a total of 676,513 doses of COVID-19 vaccine that have been administered across the state. 417,436 of those are first doses, 259,077 are final doses. Let me put that number in perspective. As of this morning, almost 1 out of every 3 Maine people has received at least their first dose of vaccine, and almost 1 out of every 5 Maine people has completed their vaccination series. So we are making steady and sustained progress. I want to take a quick second to talk just a little bit about some questions that have come up around vaccines, what they do, and what they offer. The first is a question around what it means to be fully vaccinated and what that means for you. Being fully vaccinated refers to having had at least 14 days after your second dose of Pfizer or Moderna vaccine, or 14 days after you've gotten your single dose of J&J vaccine. Now, what's going on with that 14 days? Why isn't it the immediate time period after you got your second dose or your first dose? What's happening during that 14 days is that your body's immune system is taking that vaccine and fortifying your body's own response so that if you encounter the COVID virus out in the wild again, your body's immune system will be ready. And that process takes about 14 days. But what does it mean to be fully vaccinated? Well, it means, among other things, that you can, as we talked about a few weeks ago, gather in a private residence with other people who have been fully vaccinated and not have to wear a mask, provided that every other person there in that private residence has also been fully vaccinated and there aren't unvaccinated people there. It also means that if you happen to go to another state, you can come back to Maine and if you are fully vaccinated, not need to test or quarantine. But there are more and more data that are coming out to suggest that being fully vaccinated not only reduces your likelihood of getting sick with COVID, it also reduces your chances of harboring the virus and accidentally passing it on to somebody else. Now, I want to take a step back here and have a conversation for a moment today with Maine people who are 50 and over. There are some concerning things on the horizon right now when it comes to COVID. 3 of the variants of concern have now been detected here in Maine. But there's also good news on the horizon. Just yesterday, the United States CDC published a scientific paper documenting the effectiveness of the first 2 vaccines that were initially approved, the Pfizer and Moderna vaccines. And the paper that was published in the CDC found that both of those vaccines are 90% effective at reducing your likelihood of getting COVID in real world conditions. Just as good, this same study continued to provide even more additional evidence that, as I mentioned a moment ago, the vaccines don't just prevent you from getting sick from COVID, they also reduce your chances of spreading COVID to others. These vaccines are a stunning scientific success story. This is also a good week for Maine because our vaccine allocation in the week that we are in right now is quite robust. This week alone, Maine as a state is receiving over 72,000 first doses of COVID vaccine, a significant increase, almost a 47% increase in the amount of vaccine coming into our state this week compared to just last week. This week's increased COVID vaccine allocation creates a vaccination opportunity. And Mainers 50 and over, this is what I want to talk with you about today. Please do not let this opportunity go. Don't let the virus get to you before a dose of vaccine does. For those of you who are 50 and over, who have been waiting for your vaccine, this is your week. For those of you who are 50 and over, who have wanted to wait until appointments were more available, this is your week. For those of you who have wanted to let someone else get vaccinated first, this is your week. And for those of you who have been saying you would wait until next week, I got news for you. This is your week. Your dose of COVID vaccine is waiting for you right now. Please make an appointment right now to get your COVID vaccine. As my friend Alexander likes to say, do not throw away your shot. Finding a vaccine and finding a dose is easy to do. You can go to your favorite search engine and just Google Maine COVID vaccine, and that will take you to the governor's website that contains a list of every single place in Maine that is offering COVID vaccine with a phone number or a website that you can follow to get yourself registered. Maine, I need you to make it happen. And this is the week to do it. Now, if you've been vaccinated, you can also help other people out. If you know somebody who's 50 and over, who's having difficulty navigating the registration process, help them out. We have a phone number that they can call, 1-888-445-4111 is the number to call. But you can help them too. You can help them navigate the website. You can register on their behalf. We can all help folks get vaccinated this week, particularly those 50 and over. This is an all Maine effort. Here's the bottom line. We know that so many of you have been waiting to get vaccinated. And we also know that vaccination is what puts us on the path to getting that road to normalcy, to being back to where we were before. I think the bottom line is this. We all want to get back to being vacation land. But first, we have to become vaccination land. And this is the week to do it. So with that, Commissioner Lambrou and I would be delighted to take any questions from our colleagues in the media. And the first question for the afternoon goes to Kevin Miller.
Great, thanks very much, Dr. Shah, and thank you for doing this as always. So following up on the your comments just there, checking around today, I understand there are quite a few open appointments for vaccines available this week at Maine General and Northern Lights Cross Insurance Center. Given that we're seeing these record numbers of doses, and I think a lot of people under 50 are wondering, when's it going to be their turn? Based on what you know from your federal contacts and kind of what you're seeing from vaccine providers, can you talk about when we might move to that next stage? Is it still April 19th, or do you think we might be able to move up earlier for the 16 to 49-year-old group?
Kevin, Commissioner Lambrou and I we've discussed this exact issue, and let me provide a little bit of context around that first. Kevin, I think it's important to note, first of all, that's why I'm speaking with Mainers and those 50 and over right now to encourage them to take this opportunity. We've got more vaccine coming into the state this week. This is a great opportunity to get vaccinated. I think it's also important to note, Kevin, that we are now just only 1 week into having expanded eligibility into that 50 plus category. And it's just under 13% of folks in their 50s, 50 to 59, who have been fully vaccinated. So we want to continue making inroads and offering vaccine to that population right now. That's, again, one reason I wanted to speak with everybody. Some of that excess availability is because of that one-time increase in Pfizer allocation, as well as a significant increase in the allocation that we've seen to the commercial pharmacy program. Our focus right now, Kevin, is getting those who are eligible right now in the doors so they can get their shots this week. That's what we're really focused on.
We also are planning on dialing up our own messaging about this. We have not really needed to do much work in public education because people have been eager to get vaccinated, but now we need to join with different messengers, use different messages. We're going to follow the Biden administration's lead. They will be launching a lot more campaigns to basically give people the information and the tools that they need to make their decisions on their own. But we also want to make sure that we're not leaving people behind. We have been trying to organize pop-up clinics for different communities that may struggle to get to our large-scale vaccine sites. We continue to work to get to our homebound seniors to make sure that they get their vaccinations when they can't get to some of our clinics. And we will continue to try to open up access points so somebody might be able to get a vaccine from their primary care doctor in rural Maine. So all of that work is happening concurrently as we try to drive up that 13% of people 50 to 59 years old who have been fully vaccinated or had the final doses.
Great, thank you. And another different topic, asking you, Dr. Shah, to kind of look into your crystal ball, what we're looking at potentially next year down the line. what do you think? Are we going to need to have annual COVID-19 shots, like the flu shots or booster shots? Kind of what are you seeing based on the science that you're hearing about?
Kevin, usual qualification that my crystal ball is no more clear or cloudy than anyone else's on this. But increasingly, I have heard officials from the U.S. CDC, including just about a week ago, the deputy director for or one of the heads of infectious diseases at the U.S. CDC, speak a little bit more about the possibility that COVID vaccine may be something that is annual in the same way that we have the flu shot. There are differences. I think that's important to note. The flu virus mutates quite quickly. It changes literally every year. That's why there's a new flu shot every year. Coronaviruses, which is the family where COVID comes from, don't have that same propensity to change as much. Kevin, I don't know, of course, what the answer will be. I think there are reasons why we might see a yearly COVID shot. There are also some biological reasons to suggest that there might be a little more stability. One of the factors that experts in infectious disease keep pointing to is that the more we stamp out COVID right now, the more we get folks vaccinated right now, the less likelihood there will be that the virus will circulate as well as mutate. That is to say, getting vaccinated right now is a prime opportunity to reduce the chances that we have to have yearly shots every year. It's too early to tell. There is the possibility that cold and flu season will in subsequent years become COVID and flu season. A lot of that depends on how well we do this week and in the coming weeks with getting folks vaccinated.
Great. Thank you very much.
Yep. Let me turn it over to Megan at WMTW.
Thank you so much for taking my question. This is kind of similar to Kevin's and sort of jumping off from your message that you just gave to the 50 and older crowd. Are you seeing any vaccine hesitancy or indicators of vaccine hesitancy in this group? Are you concerned that they might be opting out? I mean, it would strike me that strange that a week into opening it up, so there'd be so many available vaccine slots.
Yeah, Megan, Commissioner Lambert and I again have discussed this. Let me make two preliminary notes. The first is an open appointment or an unclaimed appointment does not mean an appointment forever goes unclaimed. That's why our first step here is to try to generate as much demand and excitement for vaccines as possible. The second is that, as we get into different groups, younger groups, we have to make sure that we're offering vaccines in a manner that is accessible to folks. As we get into younger groups, folks have jobs and being able to go somewhere in the middle of the day may not be accessible. So we're working with them to see if what we are seeing right now is a function of hesitancy or a function of folks just being busy with their lives and whether we need to make changes around that. So I think it's too early to make a final call, Megan, but we've also heard from providers across the state that they too are seeing less demand, whereas previously appointments may have opened up and been snapped up within a couple of minutes. Now it's taking a little bit more time, but it's too early to really know exactly why that is. That is, though, why I think what Commissioner Lambrew noted a moment ago about campaigns and efforts to educate and stimulate interest in the vaccine, that's why now is the time that we're doing these.
If you could, I know you kind of answered this already, but this is sort of like the backwards end around question, but what would be the benchmark for you opening or the state opening the eligibility requirements to more folks, so the 40 and over crowd? So at what point would you think that would happen?
Yeah, I don't think there's a number on the wall that prompts us to flip a switch or anything like that. We're every single day we are taking a look at what's out there, what is open, what the daily average throughput of vaccines being administered across the state is. The challenge, Megan, I think we have to be straight about this. We want to make sure that those who are currently eligible have a shot at getting their shot, that they're not boxed out or that they are not having to scramble. So that's the trade-off. That's one reason why this is, in fact, that is the reason why this is a prime week for those who are eligible, who haven't yet gotten their shot, to make an appointment and get vaccinated. This is a prime opportunity. We've seen open appointments. We have a lot of vaccine coming into the state. There are new opportunities to get vaccinated. For example, Shaw's Pharmacy is now online here in Maine. This is the week to make that happen.
One last question, and it's switching gears. We've reported that nationally there have been added cases among children. Wondering if we are seeing that here in the state, and of course, if that's something on our radar.
We haven't seen an increase in the fraction of new cases that are accounted for by children. We have seen, however, an increase in the percentage of cases that are accounted for by young people. Some of that is a function of the fact that those who have been vaccinated in Maine are older folks, 50 and over, for example, right now. And when they are protected, what that leaves you are folks who are younger. But in terms of children, say, for example, 12 and under, we've continued to see cases, but we haven't seen a significant increase there. We have seen an increase in those in their 20s and 30s. But again, much of that is a function of the fact that those who are older are now vaccinated. Not entirely, and that's why those in their 50s don't waste this opportunity.
Yep, and we did last week when the Department of Education put out its bi-weekly health advisory related to schools. We still see that our new case rate in schools in the last 30 days is 25% below the statewide rate. So we do continue to see that there is, again, there's some shifting going on, but we do know that even just looking at the school age population, we find that people in schools are less likely to be getting new cases than the statewide average.
Thanks, Megan. Over to Brian Sullivan.
Thank you, Dr. Shah. And just sort of what Kevin and Megan were each asking about, and I'll try to ask it maybe a different way. If this is people 50 and over's week, if you pick your head up a week from today and you see appointments as readily available as they are, even on Saturdays when most people have off, and the goal is to get as many people vaccinated and shots in arms across the state, isn't it time to open it up to people that want it?
Brian, I can't speculate on what we might do a week from now. Let me offer some additional analysis on this point, though. First of all, this is the week. This is the week to take advantage of the fact that there are slots available and the vaccine to fill them. This is the week to get your shot. The other thing, though, that we do, in addition to generating excitement, interest, and demand for vaccine, is we're also moving vaccine around. What we've seen is that the demand for vaccine is not necessarily uniform in different parts of the state. Some parts of the state, although we have focused on areas that have open appointments, we're also seeing other parts of the state that have waiting lists and reserve lists and are fully booked out for the next week or week and a half. So we're moving doses around the state from places where there may be a little bit less demand to places where there may be a little bit more demand to engage in that load balancing. Now, we've done this since December 14th, but it's even more important this week so we can try to balance that load. All the more reason why this is the week to get your shot.
And I'll add that, we are watching what the supply is. Again, as Dr. Shah said, we were pleasantly surprised that this week's supply is so much higher than last week, which is accounting for part of the reason for these appointments being open today on Tuesday. People didn't know, so the appointments are just opening up. So it's a good reminder that we are rolling with a changing vaccine supply. But currently, a little over half of eligible people in Maine can get a vaccine. That's that 50 years and older category. When we move to everybody else, people ages 16 to 49, that is effectively doubling the number of people who are eligible. We want to get there. We're excited to get there. We're hopeful that with continued higher supply of vaccine doses, we can get there sooner than we expect. But we don't know that until, number one, we see how well we do this week with people currently eligible, and number two, what that vaccine supply looks like.
And a question about billing. We've had a couple of inquiries to the station. People, perhaps, I know that there's no fee for the shot, but the services in providing the shot. People have that have insurance have received some bills that end up zeroing out, but people who are uninsured getting possibly charged for the services that aren't related to the shot, but just administering it.
Sure. It is against Maine policy, it's against US CDC policy for anyone, insured or uninsured, to be billed for administration of a COVID-19 vaccine. There is a federal program that is available to healthcare providers to submit a bill for somebody who's uninsured so they can get paid for that person's vaccine administration. As a reminder, the federal government is procuring all these vaccine doses and giving them to retail pharmacies and our FQACs and the state of Maine for distribution. So there should be no charges for people to get a COVID-19 vaccine in Maine or anywhere in the United States.
Thank you.
Thanks, Brian. Over to Amy Brown next.
Thanks, Dr. Shah. Will the US CDC director saying yesterday that she fears impending doom because of restrictions being lifted too quickly cause Maine to reconsider any of the reopening plans here with the cases sort of holding steady in the state?
Amy, I think one note there, Amy. I think it's really important to take just a hard look at what Dr. Walensky noted. What she noted was recurring feelings of impending doom, but really tied to what she has seen unfolding in Europe, with places in Europe, Germany is whom she singled out, but the same analysis applies to Italy and Spain as well, who were at US levels a few weeks ago and are now at significantly higher levels. That's a possibility. That is a risk. However, I think there's a really important difference between where Western Europe was a few weeks ago and where the United States is today. And that is the percentage of the population who have one or more doses of vaccine on board. The vaccination rollout in Europe has had a number of speed bumps, whereas even though in the United States we had maybe some initial concerns, it has proceeded very smoothly, such that the United States, a significantly higher proportion of people have at least some protection from a vaccine. Now, whether that distinction makes the difference in what trajectory we're on, I'm not sure. I'm more optimistic. I'm a bit more sanguine than Dr. Walensky is on this. Her concern, I understand, but that difference in vaccination makes all the difference. That was the nature of her comment. It wasn't so much tied to reopening or anything of that nature.
Okay. Once everybody who wants a vaccine is fully vaccinated, and won't the people who have declined the vaccine only present a potential danger to each other?
So they will present a potential danger to themselves because they may be harboring COVID. But there's two important notes there, Amy. The first is if we can get vaccination levels above a certain threshold. Some epidemiologists say 75%, some say 85%. We can get that above that threshold. Even those who are not able to be vaccinated or who have declined a vaccine will themselves be protected. That's where that term population immunity, or sometimes folks call it herd immunity, comes from. That is to say, the virus can't circulate in the population. So even those who haven't been vaccinated are still afforded the protection. The other thing to note, and I think that's the main point there, Amy, is that if we can get that level above a certain threshold, even those who, for whatever reason, can't be vaccinated, maybe they have a medical condition, maybe they have an allergy to the vaccine, they will still be afforded the protection. What that means is that getting vaccinated is not only something that protects your own health, it can actually protect the health of people around you.
Eventually, though, sorry.
I was just going to add, but because it will take time to get there, we still don't have a vaccine authorized for children. We still don't know who in a crowd will and will not have a vaccine or will have been fully vaccinated. That's why we anticipate that wearing a face mask, keeping distance will be with us for the coming months, because until we are to that point, which is not even in the near term, we will have to continue to do the public health protocols to protect those people, to protect our children, and to protect our communities.
Just to make sure I understand this and to follow up, that herd immunity will eventually happen, though, if the virus is still circulating with people who are unvaccinated, correct?
No. So the magic of herd immunity is that even for those who have not been vaccinated, if we can vaccinate a sufficient number of others across the population, the virus can't really find people to jump to. It can't really find people who haven't been vaccinated in sufficient numbers so it can spread across a population. So even those who haven't been vaccinated, again, maybe they've got an allergy or something like that, they are still given the benefits of the vaccine.
Okay, thank you.
Thanks, Amy. Over to Mal Meyer at WGME.
Thanks, Dr. Shah. I'm wondering if you can talk about the impact that involving EMS responders and those different agencies have had on the vaccine rollout, especially reaching some of these areas where clinics have not been readily available.
Well, Mal, you put your finger right on it. There are two. Let me first start by saying we are so incredibly thankful for the partnership of the first responder EMS clinician community throughout the pandemic. Throughout the pandemic, they have been literally on the front lines of the front line. You don't get more front line than being somebody who goes into someone's house when they're having an emergency, and with the possibility of COVID being there. My own family has had personal experience with EMS clinicians after a fall my mother took, and this was during the height of COVID almost a year ago. And I'm so thankful for the partnership that we've had with them, and we all owe them a debt of gratitude. With respect to vaccination, EMS clinicians have been invaluable to us in two ways. The first is what you referenced, Mal. They are able to provide vaccine in parts of the state where there may not be a large-scale community vaccination center. There may not be a community hospital even, but there is a fire department. And they have been holding events throughout the vaccination efforts to get people in the door to get them vaccinated. I myself am actually going to spend some time this upcoming Saturday at a drive-through event that's being organized by Buxton Fire and Rescue by Chief Schools there. They've done a couple before, and they can vaccinate a large number of people in a short period of time. The other thing, though, Mal, that EMS clinicians have brought to the vaccination effort is something that can't be understated, which is trust. In an era where there's a lot of skepticism, hesitancy, or outright opposition to vaccines, the trust that EMS officials bring and the stature that they are held in their community means that they can tap into and vaccinate folks who may not otherwise want to go to a large-scale site or who may not wish to go to a pharmacy, but they sure do trust their local fire department and their local EMS clinicians. And in an era, as we are thinking about, as we've talked about how to address hesitancy, that trust, that stature is something that is invaluable to us, and we really owe them so much thanks.
In talking to Maine EMS, they said that they're using their own scheduling platform right now, but they will be moving to the state registration system once it gets up and running. Can you provide an update about where that state registration system currently stands?
Sure, Mal. So right now, not now, but not long ago, a week ago or so, we released the second phase of that. The first phase was opening the phone line. The second phase was pre-registration. Pre-registration has been live now for over a week, or about a week, and we have pre-registered over 60,000 people who have said, I would like to be vaccinated when an appointment is available. 66,484 is the exact number of folks who have pre-registered. The next phase now, Mal, is converting those pre-registrations to registrations. And that's something that we will be working on and releasing very, very soon. I don't have an exact date on the calendar, but I can tell you it's very soon.
So that part of the website is not live yet?
It is not live yet. That the actual registration piece is not live. The first step of that will be taking those who have pre-registered, sending them a code that allows them to convert that pre-registration to a registration. That's going to be happening soon. And then opening it up even more generally for folks who haven't even pre-registered to snag an appointment.
Thank you, Dr. Shah.
Yep, thanks, Mel. Over to Ashley Blackford at WAGM.
Hi, Dr. Shah. I have two questions for you. The first one, we've had a few viewers contact us wondering about the expiration date on their vaccination card. Is that just the date that the batch expires?
No, it's a certain date forward after your vaccine itself. The batch expiration date is more about when the vaccine has to be put into somebody's arm, either when the vial is on the shelf or after it's been opened. What's on that card is the CDC's best guess, but that is very likely to change based on studies that are coming out. I don't know when and in what manner it will, but I wouldn't focus too much on the expiration date, to be candid with you. What matters right now is getting vaccinated and getting that protection on board. Whether, and sort of going back to earlier question from Kevin, whether you have to have a booster or something like that, that's a bridge that we'll cross when we get to it.
Okay. And do you have any update on the Aroostook County Jail outbreak there?
Yep, we do, Ashley. Let me get you the latest numbers first. So as of this morning, there were a total of 4 cases associated with the jail. There has been subsequent rounds of testing at the jail, and I'm going to. So let me just, as you know, in an outbreak setting, one of the things that we recommend are frequent rounds of universal testing. The Aroostook County Jail did another round of testing. They have another round of testing at the end of this week, and that follows a round of testing that they did at the end of last week. At the round of testing they did at the end of last week, they discovered no new cases, and then they have a repeat round of universal testing at the end of this week.
Okay, thank you.
Over to Robbie Feinberg next.
Thanks, Dr. Shah. When looking at the state vaccination dashboard, it looks like about a quarter of folks over 80 and I think 18% of those in their 70s still haven't received the first dose of their vaccines. Do you think that might be still a sign of a vaccine hesitancy with those folks? And I guess when you talked about some of the outreach and education efforts earlier, are you focusing on those kind of specific populations around that?
You know, I'll start, but Commissioner Lambert and I have discussed this extensively with our team. There may be hesitancy, but the thing what we worry about a lot in that group is access. Many of those in that group may be homebound. They may need a ride. They may have challenges accessing or scheduling vaccine. We've put programs into place working with our colleagues at ODES, AARP, area agencies on aging, and the Office of Maine Care Services to ramp up and provide vaccines to homebound Mainers, as well as to provide rides, things like that. I should stop talking. The commissioner is far more knowledgeable about this than I am.
No, you said you hit the nail on the head. We are continuing these programs, including we sent a letter to 51,000 people on Maine Care who are age 50 and older, talking about their eligibility, explaining why they should get vaccinated, as well as reminding them of transportation options to get back and forth. We've previously mentioned our homebound program, which we are, again, continuing to implement, working with home health agencies, potentially EMS, our public health nurses, to get at those people who cannot get to a site. We are also continuing to work with nursing facilities and other residential care facilities because they get new patients. And we stopped those vaccine clinics on site at nursing facilities a few months ago. So just today, for example, we issued some guidance that tells hospitals, if you are discharging a person to a long-term care facility, try to give them a Johnson & Johnson 1-dose vaccine before they go. So we're not trying to trace people to their destinations, like, you know, nursing facilities, psychiatric hospitals, even home settings where they need home health care. So we will continue all of the above, including, for example, we'll be reaching out to independent primary care doctors, specialists who treat people with conditions like cancer and, you know, diabetes who are at greater risk. We will continue all of these special efforts to complement our large throughput sites to make sure that we are not just expecting people to come and find us to get a vaccine, we're reaching out to them.
Great, thank you. And then just one more question we got from a school nurse. With 16-year-olds and older eligible to get a vaccine starting on the 19th, is the CDC working with high schools at all that are ready to offer the vaccine to their students?
So I'll begin and then Dr. Shah can go. You know, we are working on guidance because it is going to be different. Consent will be different. The places where these children can get vaccinated will be somewhat different because, as a reminder, only the Pfizer vaccine is authorized for 16 and 17-year-olds. The Johnson & Johnson Janssen vaccine is not, nor is the Moderna vaccine. So we will be working on guidance. We will most likely at the beginning expect them to, like other Maine residents, go to sites rather than doing special clinics, but we appreciate there's some special challenges and we're working our way through it. Director Shaw?
No, that's exactly right, Robbie. We certainly want those who are 16 and over to be vaccinated, but given that right now that limits them to the Pfizer vaccine, that is again a vaccine that requires ultra cold storage. It can't live outside of that ultra cold storage environment for too long. And that's why the Pfizer vaccine has been one that we've used in fixed locations that have ready access to those ultra cold freezers. That makes it difficult to us. That may all, of course, change if authorizations change, but right now there's nothing on the horizon like that. So for those who are 16 and over, what we're working on is making sure that their parents know which sites are offering the Pfizer vaccine, for example, things like that to make it as easy as possible for them to get vaccinated.
Great, thank you.
Over to Jessica Piper at the BDN next.
Thank you, Dr. Shah. First off, I wanted to ask you about the variants. There have now been these 3 detected in Maine. There were some estimates, I think about a month ago, suggesting that variants would become the predominant strains in the Northeast by the end of March. Is that the case here? And does it have anything to do with kind of the slight upward trend in cases that we've seen?
A bit of a mixed bag there. Let me first start, Jessica, by just talking a bit about how we find these variants. The US CDC a while back recommended that states sequence at least 5% of their positive results and undertake that DNA analysis, that deep dive into figuring out whether the virus is a variant or a regular one. I'm proud to say Maine has actually exceeded that 5%. We are over that 5% threshold. So we are sampling and testing more than what the US CDC recommends that states do. That's one reason, of course, in public health, when you look for things, you find them. And that's one reason we're finding things. That's a good thing. We want to know what's out there. It is possible that the variants that we've detected in Maine, all 3 that are of concern, are one of the reasons for a sustained number of cases in the state. That is a possibility. It's difficult to know how much of a possibility or how much of a function that's playing. But to the point you raise about whether these variants of concern are the predominant strain that has been detected, that's not the case in Maine. It is the case in some other states. That is the case, or maybe not the predominant strain, but a strain of significant fraction. That is what's happening, for example, in Florida, as well as some other states. It's not what's happening here. We are on the lookout for it, though. And that's, again, one reason why getting vaccinated is critical, as well as the traditional public health measures. It's one reason why we still recommend face coverings and why we're not letting up on a lot of those pieces of guidance.
Thank you. And then with respect to vaccinations for people in their 50s this week, are there specific providers you can recommend who might be doing evening vaccinations or something else creative for individuals who are still working, 9 to 5?
So a few, Jessica. I'm not there. Different providers are doing different things. I've talked to a number of site operators and clinicians over the past couple of days to get a better sense of what's happening. Many are opening up really early morning hours. Some are, as you noted, providing some evening hours. Others are looking at different ways to make vaccine more available. I'll try to get you a roll-up rather than just going through it here. But I think the bottom line, what I would recommend for folks to do is to go to your favorite search engine, type in Maine COVID vaccine, you will find that list. And from there, depending on where you are, you can click on a site to see what's available. And whether it's a retail pharmacy, whether it's a medium or large scale site, this is the week to do that.
Thank you.
And the final question for the afternoon goes to Patrick Whittle.
Thank you very much. I have a couple of things. I fielded a number of calls and emails from readers who have talked about a lack of availability of the vaccine at small or independent pharmacies, and others who said that some of the bigger pharmacies haven't necessarily been fastidious about sticking to the 2-week scheduling protocol. So I guess what I'm looking for is like sort of a state of the pharmacies sort of update here about what's going with those two things.
Let me first start with independent pharmacies, Patrick. In fact, just a few hours ago, our immunization team had the opportunity to meet with representatives from the pharmacy community here in Maine to chart a course for independent pharmacies across the state. Some of that will involve doing what they've already been doing, which is working with us for long-term care facilities with new residents and staff. Some of it may involve what Commissioner Lambrou noted, which is furnishing vaccine to homebound folks, but also simultaneously getting ready to offer vaccine at their storefronts. For a lot of places in Maine, they may not have a retail chain pharmacy, and the independent pharmacy is the most trusted location in town. We are hoping to be able to furnish vaccine to them as we get a better sense of the supply. As to the retail pharmacies, the chain pharmacies, we've heard those concerns and complaints as well. We forwarded them on to the various representatives to make sure that they are making second doses available. That's been a concern that's been raised. Getting those second doses scheduled on the right time frame, and then making sure they're also adhering to our full use policy. So when we get those concerns, we forward them on and make sure that they're being acted upon.
Okay, good to know that. Additionally, there's sort of been a lot in the news recently about passports and the possibility of vaccine passports playing some kind of a role either in the public or private arena going forward. Is Maine addressing that in any way?
Well, it's, what I will say, Patrick, and Commissioner and I again have had the chance to discuss this. The vaccine passports or vaccine certifications, they go by somewhat different names. They do offer operators of different venues, be it a stadium or a concert hall, the opportunity to provide a somewhat safer space for those who are there. Of course, they have to ensure that they are abiding by things like gathering limits, which may continue to be in place. But that approach, this passport or certification approach, is not without concerns. There are significant concerns about data privacy, as well as significant concerns about equity. If the passport presupposes that you have to be vaccinated, have we really done a good job getting those folks vaccinated in the first place? I think that's why right now, Patrick, our focus is on getting folks who are eligible in the door for vaccination. That's really what we're focused on right now.
Okay, terrific. And one final thing. Can you speak? You spoke a little bit earlier about the possibility of reducing transmission through getting more coverage in the community. How much do we know now about just how much the available options succeed in slowing the transmission of the virus?
There is more science coming out about that just about every week. The paper I picked up is literally the article that the CDC published yesterday on this. I'll put it on social media for folks to take a look at. But this article had nearly 4,000, this study had nearly 4,000 individuals in it. And what they did was, what was different from previous studies is that they asked folks who had been vaccinated, as well as those who hadn't been vaccinated, to get a weekly COVID test. And that way they were able to see, even amongst vaccinated folks, what their likelihood of harboring the virus was. And what this study found was that not only did the vaccine significantly reduce your chances of getting COVID if you've got the vaccine, it also reduces your chances of just harboring the virus in your nasal passages. It seems like, Patrick, every week or two, a new well-done study comes out that substantiates what experts in infectious diseases thought all along, what folks like Dr. Fauci and Dr. Walensky have speculated all along, which is that this vaccine not only reduces your likelihood of getting sick, but also your likelihood of transmitting COVID. That is a double reason why this is the week to get vaccinated.
Okay, great to know. Thank you.
Great. Well, thank you all for your time. Commissioner Lambrou, let me turn things over to you.
Yeah, well, I would like to go back to the question earlier about people being charged for a COVID-19 vaccine, which should not be happening, to talk about the affordability of healthcare. Last week, we had some great news from the federal government. People who are uninsured or who struggle to find affordable health care have more time to sign up for a special enrollment period under the Affordable Care Act's healthcare.gov. The administration announced that you had not just till May 15th, but until August 15th to sign up for a health plan that usually comes with some sort of tax credit that lowers your costs. These are quality, affordable plans, and we urge everybody who needs affordable health care to go to coverme.gov to find out their choices. Additionally, we learned that those people who already have coverage through healthcare.gov can qualify for even more financial help. Your premiums could be even lower if you go back, check out your application, look at your options, because you may be able to pay even less for coverage during the pandemic on healthcare.gov or coverme.gov. If you need more help, you can also call 1-800-965-7476. These Affordable Care Act health insurance options have been a lifesaver for millions of Americans over time, but also during this pandemic. We urge all Maine residents who need affordable health care to check out coverme.gov.
Thank you, Commissioner. And thanks to everyone who's taken some time out of your day to hear the latest on COVID. Thanks to all of our colleagues in the media for their questions as well. Hope everyone has a good day. As always, please be kind and take care of one another. We will all talk again soon.